Hello, I'm Antoni Chan, a rheumatologist from the United Kingdom, and today I'd like to talk to you about some of the new data that's come on in the area of axial spondyloarthritis. I'm going to highlight 3 abstracts that have come on, and I think they're really important in terms of new therapies for this particular disease area. Firstly is a late-breaking abstract, L2, which is looking at the use of secukinumab in the non-radiographic axial spondyloarthritis group. Now we know that secukinumab is an IL-17 inhibitor, and it's been used in the radiographic form or ankylosing spondylitis. But this new study called PREVENT looked at the use in the non-radiographic group, and it achieved its primary endpoint, which is the ASAS-40, and also some of the secondary endpoints as well. In addition, there were no significant safety signals from the study. Another abstract which was presented today is abstract 2729, which is the use of another IL-17 inhibitor called Kazuma. And again, this is in the area of non-radiographic axial spondyloarthritis. Again, in this placebo-controlled trial, patients were given the 80 milligram dose at 2 or 4 weeks against a placebo arm, and the patients again achieved the primary endpoint, which is ASAS-40, and they again achieved their secondary endpoints, again with no safety signals. Both these studies open up a whole new area of the use of interleukin-17 inhibitors in the non-radiographic group, which for a long time we have not been able to access because the data was mainly in the radiographic arm. And I think the important points of both these studies is, firstly, we got a new mode of action in this particular group of condition. Secondly, we know that the bar for the primary outcome is now changed. We used to look at ASAS-20, but now we're starting to look at ASAS-40. And thirdly, the most important thing is that there were no new safety signals in this study. The third abstract that I want to describe is the use of JAK inhibitors, in particular upadacitinib, which is a JAK inhibitor. And this particular study is a short study, up to 14 weeks, to look at its efficacy. It's a phase 2/3 trial in the use in radiographic ankylosing spondylitis. And the primary outcome measure was the ASAS-40 and also the achievement of BASDAI-50. And this study showed that the particular JAK inhibitor, upadacitinib, achieved its primary outcome measure with no new safety signals as well. So I think this is a really exciting time for the field of axial spondyloarthritis, where we are now starting to see a lot of these new modes of actions coming along, and certainly that would increase our ability to treat our patients better. And most importantly, we have not seen any new safety signals from all these 3 studies, which is really an important message in terms of how we would be thinking about using these drugs for our patients. So thank you very much.